Hi, I'm Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. Today we are going to talk about the menstrual cycle, and it's not just about how you're ovulating and when is a good time to try to conceive. I'm going to talk about the hormones also and how they are being released during the entire menstrual cycle. So let's begin with the first day of your period. This is the first day of your period. The next 5 days are called as menstruation, as the period duration. So the first 5 days there is shedding of the endometrium and it's called as menstrual period. Now from day 5 to day 14 is a period called as follicular phase. In this phase, eggs are being selected for the next cycle. So from day 5 to day 14. On day 14, this is a very important day, the egg is being released. It's called ovulation day. That's the day egg is released. If there are sperms available one day before or a day later inside the uterus, that is if intercourse has happened, there is a good chance that you may conceive. So 14th day is when the egg ovulates. Now all this is assuming that the period duration, the entire menstrual cycle is for 28 days. So I will explain if it is longer, shorter, how to calculate all this. So on day 14, if you have a 28-day menstrual cycle, on day 14 you ovulate, which is called as the follicular phase. The next phase from day 14 to 28 is called as the luteal phase. In this phase, the endometrium gets ready to give support to the embryo that might have been formed. After ovulation, if the egg fertilized, an embryo is formed. The embryo is then transferred into the endometrium, the uterus. So the uterus has to get itself ready to provide enough nutrition for the embryo to develop there. So this phase is called as the luteal phase. During this phase, different hormones are released. We'll talk about the hormones later. This is called as the luteal phase. And if the embryo is not formed or it does not implant, then the endometrium, that is the lining of the uterus, will shed, and on day 28 or later you will have your periods again. So again this cycle is repeated. So this is what happens, and these are the phases. First day to 5th day is called as menstruation, that is period duration. Then till day 14 it is called as follicular phase. Day 14 or 15 the egg ovulates, and then later is called as the luteal phase. This is a 28-day cycle. For instance, if you have a 31-day cycle, what you need to do is go back, and it is regular, it is a 31-day regular cycle, then you have to calculate behind and see day 14 or day 15 is the day of your ovulation. So no matter what the duration of the whole cycle, it is 15 days behind the menstruation that you ovulate. So if you have a regular cycle, whether it is day 30 or 28 or 29, just calculate 15 days behind, and your body will also give you some changes, which is when you can assume that you are ovulating. Of course, there are many kits also available called as LH kit, luteinizing hormone kit, which is also useful for predicting the ovulation. These are the phases. Now let's look at the hormones which are being released. There are 4 important hormones called as FSH, LH, estrogen and progesterone. So FSH, a follicle stimulating hormone, as the name suggests, is released during the first phase, during the follicular phase. During this period, eggs are being selected, and out of those selected eggs, only one will ovulate around the 14th day of your cycle. So this is very important. FSH, follicle stimulating hormone, is very important at this phase. LH, luteinizing hormone, is very critical for making the egg ovulate. So the LH surge comes from the pituitary, from the brain, and this increase in luteinizing hormone will make the egg ovulate. Estrogen, on the other hand, is from the eggs that are growing. Like I said, during the follicular phase, many eggs are selected, out of which only one is ovulating. But all these eggs are also releasing estrogen. Estrogen is very important for follicular development, for egg development, and finally the release in the ovulation period. Then P4, progesterone. Progesterone is very important for the later phase, the luteal phase. This is the phase where the endometrium needs good blood supply so that it can provide nutrition to the embryo, and that is when P4 or progesterone plays a role. So these are very critical hormones, and they play a very important role on different phases of your menstrual cycle. If you were to understand this, it's very easy to depict where the menstruation, where the cycle is going wrong. So now you understand why these tests are performed on day 2 of your cycle or until day 3 or day 4. Follicle stimulating hormone can be tested, and depending on the values, we get to know if the cycle is going well. Estrogen and P4 are calculated later to understand if they are rising, so that we can assume there is a proper growth of endometrium. So these hormones are very critical, and testing of these hormones can give us a status of your menstrual cycle, and based on that the ovulation also. If you wish to understand more about this, you are trying to conceive and not able to understand your menstrual cycle, please feel free to contact us for more information. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.